You are the nurse assessing a 19-year-old male who presents to the emergency department with chest pain. He localizes the pain to the left parasternal region, and the pain is reproducible with direct pressure. You take his vital signs and they are all within normal limits. He says that he is a very active student who frequently lifts weights, rows crew, and runs marathons. What is the most likely diagnosis? A. Peripheral vascular disease. B. Diabetes mellitus. C. Acute coronary syndrome. D. Costochondritis. E. Pulmonary embolism. The answer is D. Costochondritis. Costochondritis is an inflammation of the cartilage that bridges the sternum to the ribs. It is a very common cause of acute chest pain in young, healthy, physically active individuals without known cardiovascular disease. In this case, we have a very prototypical case, a young, physically active, especially with physical activity involving the chest like weightlifting and rowing crew, otherwise healthy male with focal, reproducible chest pain in the parasternal area, and normal vital signs on presentation. When you see this history, this is a rather convincing case for costochondritis. There is no information given that would seem to indicate a personal or family history of cardiovascular disease, and thus, costochondritis would be the best answer choice. He can be treated conservatively with NSAIDs for anti-inflammatory and pain control effects. Acute coronary syndrome, for example myocardial infarction, is very unlikely in this patient as he is young and healthy, has reproducible, focal chest pain, is very physically active, and has stable vital signs. If there was a personal or family history of cardiovascular disease, or any report of recent drug use, particularly cocaine, then this could be higher on the differential. Pulmonary embolism is very unlikely in this patient as there is no leg swelling reported, the chest pain is focal, the patient is healthy and active, and his vital signs are normal. Peripheral vascular disease would not present with chest pain, and would be highly unlikely to be present in an otherwise healthy 19-year-old. There is nothing to suggest that this healthy, active 19-year-old patient has diabetes mellitus from the information provided. You are a nurse at an orthopedics clinic. You are taking care of a football player who suffered a very painful right knee injury. You are concerned that he may have injured the unhappy triad. Which of the following correctly lists all components of the unhappy triad within the knee? A. PCL, LCL, lateral meniscus. B. PCL, MCL, medial meniscus. C. ACL, MCL, lateral meniscus. D. ACL, LCL, lateral meniscus. E. ACL, MCL, medial meniscus. The answer is E. ACL, MCL, medial meniscus. The unhappy triad is frequently injured in athletes who participate in contact sports, such as football. The injury mechanism often involves a direct, forceful hit to a firmly planted leg. The hit is forceful enough to rupture two ligaments, ACL and MCL, as well as the medial meniscus. The treatment for such an injury involves surgical intervention and a lengthy recovery period, though for patients inclined to partake in the rehabilitation process, they can often return to their desired sports after completion of surgery and rehab. You are a nurse in an emergency department and a patient presents following a bicycle accident in which he fractured his right radius and ulna. The patient complains that he cannot feel his extremity distal to the fracture. The right upper extremity is pale, painful, pulseless, and cool to the touch, and the patient complains of occasional pins and needles within and distal to the injury. You note a great deal of swelling around the fracture site. Which of the following is the most likely diagnosis? A. Limb necrosis. B. Vasculitis. C. Compartment syndrome. D. Lupus. E. Fat embolism. The answer is C. Compartment syndrome. Compartment syndrome is a surgical emergency in which an injury results in hemorrhage or swelling in an enclosed space that causes dangerously high pressures to build within the enclosed space, resulting in compromised blood flow to the muscles and nerves within and distal to the space. The symptoms include a cool, pale, pulseless extremity that may also experience paresthesis, and that is visibly swollen and tense. In this case, the patient's right arm exhibits all of these characteristics, and this presentation is highly consistent with compartment syndrome. The other choices are incorrect. Vasculitis and lupus are both autoimmune conditions that may result in limb swelling, but would be unlikely causes of this patient's presentation, especially in the setting of a recent local trauma to the affected limb. Fat embolism would not account for the patient's constellation of symptoms. There is no evidence of limb necrosis at this stage of the patient's injury. Should the compartment syndrome not be addressed and vascular flow remain compromised by persistently high pressures, then limb ischemia and consequent necrosis could be a downstream effect. What syndrome presents with pain or stiffness, usually in the neck, shoulders, and hips, which may be caused by an inflammatory condition of blood vessels such as temporal arteritis? A. Myositis. B. Guillain-Barré syndrome. C. Amyotrophic lateral sclerosis, ALS. D. Polymyalgia rheumatica. The answer is D. Polymyalgia rheumatica. Polymyalgia rheumatica is an inflammatory musculoskeletal condition that presents with pain or stiffness, usually in the neck, shoulders, and hips. Amyotrophic lateral sclerosis, ALS, is a genetic disorder of muscle wasting and neuronal death. Symptoms include progressive muscular weakness, leading to paralysis and death. Guillain-Barré syndrome is a rapid onset condition of reversible muscle paralysis and weakness following infection, most commonly Campylobacter jejuni. Myositis is a general term for inflammation of the muscles, and can be due to various causes. Duchenne's muscular dystrophy is caused by dysfunctional production of what protein? A. Dystrophin. B. Actin. C. Dystroglycan. D. Troponin. The answer is A. Dystrophin. Duchenne's muscular dystrophy, DMD, is caused by dysfunctional production of dystrophin, a protein that is part of a complex of proteins that anchor the cytoskeleton of a muscle cell to the extracellular matrix, also known as the dystrophin-associated protein complex. Its absence disrupts multiple intracellular signaling pathways, leading to muscle necrosis. Dystroglycan is another protein in this complex, but it is unaffected in DMD. Actin and troponin are also unaffected in DMD.